Ladies and gentlemen, welcome to today's lecture on medical nanotechnology. Today, we will be exploring the fascinating field of nanotechnology and its applications in orthopedic implants. Nanotechnology is a rapidly evolving scientific discipline that involves manipulating materials at the nanoscale, which is approximately 1 to 100 nanometers in size. This field has shown immense potential in revolutionizing the medical industry, particularly in the development of advanced biomaterials, nanoscale surface modifications, and nanotechnology-based drug delivery systems. Let us begin our discussion with an introduction to nanotechnology in the context of medical applications. Nanotechnology refers to the precise engineering and manipulation of materials at the nanoscale level to enhance their properties for various applications. In the medical field, nanotechnology has been hailed as a game changer, offering innovative solutions to address healthcare challenges. The unique properties exhibited by materials at the nanoscale, such as increased surface area, improved mechanical strength, and enhanced biological compatibility, have paved the way for significant advancements in orthopedic implants. Biomaterials science forms the foundation of medical nanotechnology. It encompasses the development and characterization of materials that interact with biological systems to diagnose, treat, or replace damaged tissues. In the context of orthopedic implants, biomaterials play a crucial role in providing structural support, facilitating tissue integration, and promoting healing. The integration of nanotechnology into biomaterials design has led to the development of novel implant materials with improved biocompatibility, mechanical properties, and infection resistance. Nanomaterials, such as nanoparticles, nanotubes, and nanofibers, have gained significant attention in the field of orthopedic implants. These materials possess unique properties, including high surface area, enhanced mechanical strength, and tunable drug release capabilities. By incorporating nanomaterials into implant surfaces, researchers have achieved improved osseointegration, reduced wear and corrosion, and enhanced antibacterial properties. This has resulted in implant materials that demonstrate superior performance and longevity, ultimately benefiting patients with enhanced implant functionality and reduced risk of complications. The surface properties of orthopedic implants play a crucial role in determining their performance and long-term success. Nanotechnology offers effective methods for modifying implant surfaces at the nanoscale to improve biocompatibility, reduce bacterial adherence, and promote tissue integration. Techniques such as nanopatterning, nanocoating, and nanotexturing have shown promising results in enhancing cellular adhesion, promoting osteogenic differentiation, and reducing inflammation. These nanoscale surface modifications have the potential to revolutionize the field of orthopedics by significantly improving implant integration and patient outcomes. Drug delivery systems based on nanotechnology have emerged as a promising approach to improve the therapeutic outcomes of orthopedic treatments. Nanoparticles and nanocarriers can be designed to encapsulate drugs, growth factors, or therapeutic agents and precisely deliver them to targeted areas. This targeted drug delivery allows for site-specific treatment, reduced systemic toxicity, and sustained release kinetics, optimizing the healing process and minimizing side effects. Nanotechnology-based drug delivery systems have the potential to revolutionize the way we administer medications in orthopedic applications. Monitoring the performance and condition of orthopedic implants is crucial for ensuring their long-term success. Nanotechnology has enabled the development of implantable nanosensors capable of real-time monitoring of various parameters, including implant stability, mechanical stress, infection detection, and healing progress. These nanosensors provide valuable insights into the implant's performance and allow for timely intervention, reducing the risk of implant failure and improving patient outcomes. The integration of nanosensors with orthopedic implants represents a significant leap forward in personalized medicine and postoperative monitoring. Load-bearing implants face significant challenges in terms of mechanical strength, wear resistance, and fatigue performance. Nanocomposites, which combine nanoscale fillers with traditional implant materials, offer a novel solution to enhance the mechanical properties and durability of load-bearing implants. By incorporating nanoparticles into the matrix of implant materials, researchers have achieved improved strength, toughness, and wear resistance, reducing the risk of implant failure and improving patient mobility. Nanocomposites hold immense promise in the development of next-generation load-bearing implants that can withstand the demands of daily activities. Nanotechnology plays a vital role in the field of tissue engineering, which aims to regenerate or repair damaged tissues using a combination of cells, biomaterials, and signaling factors. Nanoscale cues can guide cell behavior, including adhesion, migration, and differentiation, mimicking the natural cellular environment. By incorporating nanomaterials, nanofibers, and nanoscale signaling molecules, tissue engineers can create scaffolds and constructs that closely resemble the native tissue architecture. This integration of nanotechnology with tissue engineering holds great promise for the regeneration of musculoskeletal tissues and the restoration of function. As with any emerging technology, the safety aspects of nanotechnology must be thoroughly explored. Nanotoxicology focuses on understanding the potential risks associated with the use of nanomaterials and ensuring their safe implementation in medical applications. Researchers investigate the interactions between nanomaterials and biological systems, studying their potential toxicity and long-term effects. Safety assessments of nanomaterials utilized in orthopedic implants are important to minimize any potential risks to patients and healthcare professionals, ensuring the safe and effective implementation of medical nanotechnology. The successful translation of medical nanotechnology from the laboratory to clinical practice is vital to revolutionize patient care. Various clinical applications of nanotechnology in orthopedic implants have been explored, including joint replacements, bone grafts, and drug-eluting implants. Through in-depth case studies, we can examine the performance, clinical outcomes, and patient experiences associated with these nanotechnology-based orthopedic implants. These case studies provide valuable insights into the efficacy, challenges, and future potential of incorporating nanotechnology into clinical practice. The integration of nanotechnology in healthcare raises important regulatory and ethical considerations. Regulators play a crucial role in ensuring the safety, efficacy, and appropriate use of nanotechnology-based medical devices. Various regulatory frameworks and guidelines have been developed to streamline the approval process and ensure standardized manufacturing practices. Additionally, ethical considerations, such as patient privacy, informed consent, and societal impact, must be carefully addressed to foster responsible and equitable use of medical nanotechnology. The field of medical nanotechnology continues to evolve at a rapid pace, presenting exciting possibilities for future advancements in orthopedic implants. Ongoing research efforts are focused on the development of multifunctional nanomaterials, personalized implants, and smart sensing capabilities. Furthermore, the integration of artificial intelligence, robotics, and nanotechnology holds the potential to revolutionize surgical techniques, rehabilitation protocols, and patient care. The future of nanotechnology for orthopedic implants is indeed promising, and it is crucial for researchers, clinicians, and students to remain at the forefront of these cutting-edge developments. In conclusion, medical nanotechnology has brought significant advancements to the field of orthopedics, offering innovative solutions to improve implant performance, patient outcomes, and quality of life. By harnessing the unique properties exhibited by nanomaterials, nanoscale surface modifications, nanotechnology-based drug delivery, and implant monitoring technologies, researchers have paved the way for personalized, efficient, and safe orthopedic interventions. However, it is essential to continue exploring the safety aspects, regulatory landscape, and ethical considerations associated with medical nanotechnology to ensure responsible and optimal implementation in healthcare settings. As future healthcare professionals, it is crucial for us to stay updated with these advancements and actively contribute to the growth and development of medical nanotechnology for the betterment of patient care. Thank you for your attention, and I hope you found this lecture informative and inspiring.